I'm Kiera Morgan. Thanks for joining me on this episode of Coffee with Kiera. We are via Zoom today because we have some fantastic guests who are all throughout the state and some familiar local folks as well. So let's get started. We are sponsored by The Human Being, located in Newport and Lincoln City. So we'll start with Eric. Eric, tell us a little bit about yourself and what you do.
Well, I'm Eric Maiorano. I'm the Emergency Management Coordinator for Samaritan Health Services here on the coast. I cover both Lincoln City and Newport hospitals for Samaritan, and I've been here about 3 years.
All right. And Lorraine, tell us a little bit about you.
Well, thank you. I'm Lorraine Churchill. I'm an emergency manager by trade and by passion, as I like to say. I'm from the coast, my family is, so this is extra special for me, so thank you for having us. I serve on the Oregon Disaster Medical Team. I support their public information role as well as administrative support and patient tracking. And I've been in this line of work for about, a couple decades. And I'm just really thrilled with serving Oregon Disaster Medical Team as it is an all-volunteer medical support element. Thank you.
All right. And Eric G.
Hi, I'm Eric Gebbie. I'm with Oregon Health Authority's Public Health Division, based up here in Portland. I'm the Director of Emergency Operations and get to support a great team that's scattered around the state, helping with public health and healthcare preparedness for pandemics, tsunamis, and whatever comes next.
All right. And a name we are familiar with, Miss Samantha Buckley. Tell us a little bit about you.
Yeah, hi Kiera. Hi everyone. I'm Samantha Buckley, Lincoln County Emergency Manager, and we just talked a couple weeks ago, so I'll keep my introduction at that.
All right. Eric, tell us a little bit about this program and what you guys are going to be doing.
Sure. Our emergency management program with Samaritan is happy to be hosting OHA and ODMT, as well as the National Guard coming out to participate in the Pathfinder Cascadia exercise out here on the coast. So we're very happy to do that. Since I have been with Samaritan, we've been working very diligently on training our hospital incident management teams at both hospitals here on the coast in incident command, as well as all hazard threats that we face here on the coast. And obviously Cascadia is one of those threats. So this is a great opportunity for us not only to train, but work with our local, regional, and state partners and build those relationships up so that when we do have an event, we've all worked together and we're familiar with the program and how we need to go through things. So looking forward to this collaboration and having a good training on the 16th.
And this event is being held at Samaritan Pacific Communities Hospital, but will there be folks who will be participating from Lincoln City as well?
Not in this particular one. We have another exercise for Lincoln City coming up in June.
Okay. And Lorraine, tell us a little bit about what you will be doing with this event.
So the Oregon Disaster Medical Team is comprised of medical folks who are local. And so in the context, especially of a large-scale situation like the Cascadia subduction zone, these folks, because they're in our communities, are available more readily. And so there's that gap of time, right, where the incident occurs, and then how soon can we get outside support to come on in? In that gap, Oregon Disaster Medical Team really can lean forward and report to the hosting jurisdiction. So in this case, Newport. And we'd come and assist and just dig in and look to the local folks to say, what do you need us to do? How do we support? So we have amazing, wonderful experts from OHSU, from Samaritan Hospital, from all over the state of Oregon. And they would really, again, lean forward, triage the patients, and then organize communications and transport of those patients.
And I imagine that a lot of this is going to require, because our roads, obviously, in the event when the Cascadia hits, are going to be impassable, as we've mentioned. So a lot of this is going to require some air support too, as well, right?
That's correct. And so part of this exercise, we're finding out, and maybe Eric M. has some more information on that. He has that lovely heli spot there at the hospital. So we're hoping we might get to exercise some of that capability. We're also going to take advantage and try out for the first time at the coast, at least, the use of UAS or drones to help deliver medical supplies. So there's a regional team, a UAS team that meets all the credentials and requirements to perform. And they're homed at Scappoose Rural Fire District in the greater Portland metro area. And they're going to come on down and see and help about that. But Eric, did you want to share any more about the helispot there and capabilities at the hospital?
Sure, just really quick, we're hoping to have our Coast Guard partners participate in some way, but barring real world emergencies, they may or may not be able to participate. So we're still waiting to hear back on their participation. Nonetheless, we hope maybe to have life flight here as well. So we'll see how that happens and how real world emergencies affect those operations.
All right. Eric G., can you talk a little bit about the state's involvement with this preparedness exercise?
Sure, happy to. We've been involved over 10 years now, I think, since it was annually for a while, interrupted by COVID. We've got a role managing the State Emergency Registry of Volunteers in Oregon, which the legislature has enabled us to operate, which is a registry for healthcare providers to be ready for disasters and other needs. And that lets us enable the volunteers with like workers' protection and some other liability coverage, which licensed healthcare providers really, really want when they're volunteering in any situation and providing care. And so it's kind of that enabling factor. And then we have a general coordination role with some of our team who works around the state and with partners. We've worked closely with the Oregon Disaster Medical Team for many, many years in exercises and real responses. They've been a great partner since they are kind of a leading edge of responders that help us cross-train a lot of other volunteers who want to dabble in the response, but can't commit to that level. And then on a practical level, we're also funding a chunk of the exercise with some pass-through federal grant dollars from Health and Human Services.
That was going to be my question, was how this was being funded.
Well, and we're funding it parts of it, food and lodging and equipment and gear, but there's so much volunteer time being committed by plain old volunteers, but then also just community partners who are working on their own home agency's dime. And so I think it's probably near a dozen agencies involved, and then just volunteers who are just giving up at least many days of their time. And that's where the real work is done.
And Sam, can you talk a little bit about the importance of these types of exercises?
Yeah, of course. So these exercises give us a really special opportunity to coordinate with partners that we don't always get to coordinate with on this scale, right? So these are people that we talk to all the time and get to participate in other activities with, but we don't always get to have Oregon Disaster Medical Team here, right, on this scale to practice these types of activities. So it's a really unique opportunity for us to get to play in this way and give this a chance to sort of see where we could use some more a little more work to make it a little smoother in future. So I think it's a really great opportunity for us to kind of get that inclusion with these partners.
And you and I imagine Eric M have worked closely together outside of when you do this. Can you talk a little bit about the importance of having these partnerships?
Yes, still to me, or was that directed at Eric?
Yes, you, sorry.
Great. Yeah. So these partnerships are really important, right? We're a small rural county, and after an event like this, we are going to be really isolated. And so we're going to rely on these partnerships to help us respond and recover in a large scale Cascadia event. And we're really going to need the additional support. We've worked really hard in Lincoln County to do preparedness and improve our preparedness over the last, however many years, decades. And I think we've done a really nice job. We already have this existing relationship with the hospital. And like I said, some of these relationships already exist, but the in-person practicing, I think, is really valuable opportunity for us to sort of hone those skills and figure out where we can sort of improve for the future as well, because we'll rely on them in this event for sure.
And let's talk a little bit about what this event is going to entail. I understand you have some actor victims. Can someone jump in and tell us a little bit about the run through of what you're going to be doing?
Well, I'll jump in from the hospital side. We were very fortunate to have some nursing students from the local community college that are going to be participating, and we are going to be putting moulage or dressings on them to be as realistic as possible. So that is great. We have a few hospital volunteers as well. The hospital has a great cache of volunteers that volunteer every day here, and they're going to participate and are very excited to do so. So those are going to be great. They're going to be given instructions and have cards that tell them what injuries they have. And then our teams on all sides will be doing triage and separating those patients by those injuries and figuring out how to best route them through the systems. For our emergency department here, it's a great opportunity for our staff to practice mass casualty and triage and figure out where we're going to decompress our hospital if we are full of patients already. If it's a normal day and we have surgery or infusion or different departments that have appointments and what we have to cancel to accommodate a real life emergency like that. So this is just, again, a great opportunity to work with our local partners in doing this and get the hands-on practice that we need that we don't always get day to day.
And Lorraine, let's talk a little bit about, as Sam knows, my favorite subject, which is communications. Can you talk a little bit about the importance of that during such an event?
Yeah, that's pretty critical. I think especially rural areas are more familiar with that deep necessity than maybe other places are. Certainly, we've had Snowmageddon. We've had all sorts of other things that have brought to light, like, hey, how do we better communicate? So as part of the exercise, Oregon Disaster Medical Team will have its communication unit there and fully staffed and up and running. And we'll be testing how do we work from the coastal area all the way to the Joint Operations Center or the Emergency Coordination Center in Salem. And they're really also going to look at testing the hospital communication systems to those different elements as well. And so when volunteers come in as well, or other responders come in, how do we ensure those people right there in the pocket really doing the work are able to communicate? So that's another piece we'll look at. We'll be using things like Starlink even to kind of assure and have that backup redundancy along with our ham radio operators. So it's going to be all hands on deck for the communication piece. We are also going to do what we can to capture and record images. And then we take that again. And after every exercise, we have what are called hot washes and debriefs, which then build into after action reports so that we, among all of us, share like, this worked well for me. What was it like for you? And kind of as Sam mentioned, how do we put some more mortar in those bricks and reinforce those bricks to make sure they don't fall down during an earthquake? So we're retrofitting our capabilities that we have now and growing them larger. Does that help?
Mm-hmm. Yes, absolutely.
Awesome.
And Eric G., of course, a couple of years ago, I believe it was, we had set up at the airport a disaster area of where we could evacuate people to and things like that. Are you coordinating? Is this part of that coordination, getting people from that area to the hospital? How is that working together?
So I think for this exercise, they're practicing as if the event is not actually in the hospital parking lot, but would be elsewhere. And I think the focus is more on the command and control on site, as well as training individual clinicians on what work outside of a hospital is like, and then coordination with the hospital about that. And I'm not aware of the airfield being involved this time, but I'm sure our folks would love to exercise any time with an airport.
And can you tell us a little bit more about Oregon Health Authority's involvement in this and why it's important for you?
Sure. So our program is a combination of trying to get the state, like OHA itself, ready for its role in response, but then also pushing out the resources for locals, counties, tribes to have the resources they need to do their share as much as they can. With some things we can do, some things we can't do, some things they can do, and vice versa. And so it's a year-round program helping get ready for infectious disease outbreaks, natural disasters, an all-hazards approach. And then we would look for these opportunities with partners. Some of us would love to exercise all day, all year long, but they are big, big work. And so when we see people, volunteers with the energy and the drive to do it, we want to give them what resources they need for that, and help. There's a little bit of funding they need. Do they need some extra coordination? Do they need like the liability coverage we can offer for the volunteers? What are the things we can do to help enable that? And then we'll be looking at this. This is really important for when a big event like a tsunami hits. It's going to hit multiple regions at once, and to know who's practiced together, and then to have the insight ourselves on the ground and from the evaluation, what that can look like is really, really important, because it'd be this times 10. And seeing what one location takes for its resources, seeing who's engaged, seeing what volunteers are bringing to the table. We just need to see how that plays out. It's only an exercise. It's a fraction of what happens in a real event, but we've seen so many real events where it's people who are at an exercise together say, hey, I know you, and I know how you operate. I know where you're going to be. I haven't heard from you in hours, but I know how you operate, and I know where to connect with you. And so exchanging some business cards, having a lunch in the middle of a field at an exercise, it all adds up.
And Samantha, can you talk a little bit more about the importance of an exercise like this for the entire county? And when Cascadia hits, it's going to isolate a lot of folks, like in Toledo, in Siletz, and things like that. What are some ways that your office and the sheriff's office is working together to try to communicate with those areas and get people to a hospital, get them the help that they need in the event of an emergency?
Yeah, I think we've talked a bit before, Kiera, about how the county will be turned into a bunch of tiny islands. And so there'll be all the islanding effect. And so we really have tried to work with our partners to ensure that they have some level of preparedness within their communities. And we have really good partners in Lincoln County. They do a lot of work, and then they call us when they need a little extra support. And we love that. We've seen that before in the ice storm, for example, when communities independently put up shelters for folks and then connected with us when they needed additional support in the form of logistics and supplies. And so I think this is a really unique opportunity to have some of those conversations. I don't know that we've explicitly identified how we will move folks after an event like this, simply because of the level of destruction, right? It's hard to know exactly what the terrain will look like, what kind of resources we'll have available to us, and how long it will take for those resources to become available. But this can open an interesting door to start some of those conversations. And I think this also, in conjunction with that evacuation assembly point exercise at the airport we had a few years ago, is really setting us up to have some of those bigger planning conversations around transport throughout the county.
And are you working closely outside of this? I assume you're working closely with some of the local fire departments and first responders in those areas to kind of set up something in the event of an emergency as well?
For this exercise, we incorporated some fire early on, but like Eric said, it's super dependent on day-to-day operations who's able to join us. So for this exercise, we will likely not have a ton of fire and EMS participation. That being said, our emergency management office and the local hospital works with our fire departments and our EMS partners on a regular basis. And we definitely have these conversations in other meetings as well to sort of talk about those planning points and what kind of support they're going to need and what kind of maybe cached supplies they may need as well.
And that's what we wanted folks to know, is that these conversations are being held across the board, right?
Yeah. And I think I always want to encourage our public to also consider their personal preparedness. In an event like this, the more prepared you are on a personal level, the better off you will be. Your, first responders, people in the emergency management office and at the state, we're going to do everything we can to try to bring in support for our communities as fast as we can, but it's going to take a while. And so we really want folks to think about what they're going to need on their personal preparedness front as well. And one thing we've been having a lot of conversations about in Lincoln County lately is individuals who also have maybe special medical needs, like electronic dependent medical devices. And so if you or someone in your family or community has those special needs, thinking about what that might look like in an event where you don't have power for a while, and how you can sort of build in some individual resilience on that until we are able to come in, is really important. And so I think we've really been trying to build that community resilience as well.
All right. Let's just kind of go down the line. And Eric M., is there anything else that you would like to add from the hospital standpoint? I know you're getting ready to work with putting in an emergency water supply. Do you want to talk a little bit about that as we're wrapping up?
Yes, actually, for both hospitals on the coast, we're working on water resiliency projects to make sure that both hospitals have that capability during a Cascadia event or any kind of a disaster. Like I said, we try to prepare for all hazard events that we can, and you can't predict everything. We've had everything from windstorms to winter storms to, who knows what's next. So we want to have those opportunities to improve. And that's another thing that we look at following these exercises is what are our improvement plans and what can we look at for the future to make ourselves more resilient to these sort of things.
All right. Thank you, Eric. Thank you for what you do. Lorraine, what would you like to add in wrapping up?
Well, in some of the conversation I heard, I also want to call out that this is the first opportunity. So after COVID, there was this new thing called Oregon Regional Medical Coordination Centers. And so it will help organize and move patients to try and take some of that overburdening off the shoulders of the local folks. So that's also going to be tested and tried out here at this opportunity. So it isn't just helping the local folks. The local folks are actually helping the entire rest of the state and our region by supporting and allowing us to come and partner with them. So Oregon Disaster Medical Team, and I'm sure Eric Gebbie will also say this, huge thanks. And to Sam, she is phenomenal. I'll just say that. They've been working both Erics are awesome. I don't want to miss an Eric. That'd be bad. So it's just been, this is why I do what I do. I call it booster shots of humanity, because the people I get to work with, it's not the greatest pay in the world, right? But it's the greatest value for heart. So huge thanks to everyone and all the volunteers and folks that step up and make these things happen.
Thank you, Lorraine. Eric G., what would you like to add as we're wrapping up?
I'll just add on to the discussion about personal preparedness. Something we always like to add is that we aren't the ones saying be a prepper. Stock your big thing for the big one. Some people don't respond to that. They don't want to identify as like the prepper type, but they do want to respond to you, say, how about you prepare yourself and help prepare your neighbor? Because we're looking at healthy communities, and you think about like, okay, I do want to help my elderly mom be ready. I can do that. That's an okay thing to do. So when you're thinking about how to prepare for emergencies, it can be a lot, it can be scary, but think about those little things you can do in an ice storm with your neighbors. That's where some people actually go, all right, I can do that. So thanks.
All right. Samantha?
Yeah, that's an excellent point, Dr. Gebbie. Thank you for bringing that up. We've really, really want to encourage folks to do those small things for them and their neighbors. Healthy communities is a great way to frame it as well. So thank you for bringing that point up. And I will also echo Lorraine's gratitude for this event. It's been a real learning opportunity for us, even in the planning phases. So I've really been appreciative of them, including Lincoln County, and coming here. So we're really grateful for the opportunity.
All right. And I just want to throw in, also remember to make sure you have an emergency kit in your car, because you may not be at home when something happens. Cover all your bases. All right. Well, thank you all for joining me today on Coffee with Kiera. I'm looking forward to covering this exercise and helping people to stay informed and staying prepared. We are sponsored by The Human Being, again, in Newport and Lincoln City. Thanks for joining me on Coffee with Kiera.